Welcome to Sports Medicine on Tap. My name is Brandon O'Line. I'm sitting at Neck of the Woods Brewing Company with my good friend Dr. Frey. Dr. Frey, good evening. How you doing?
Spectacular.
What a special night tonight. We have a special guest, if you will,
Very cool.
on the phone this evening. We are talking with AJ Duffy, the 16th president of the National Athletic Trainers Association. AJ, how you doing? And thank you so much for giving us your time and coming on our show.
Well, Dr. Fry and Brandon, I want to thank you for inviting me. I've never had a finer day.
That's fantastic. So before we go ahead and get down to the nitty-gritty and have our conversation, I just want to give a quick shout-out to our sponsors, Virtual Orthopedics and Spine. They have you covered from runner's knee to dog walker's hip to yard work back and laptop wrist. They have a doc for that. So find the right specialist for you at virtua.org/ortho. So AJ, I really appreciate taking time out to join us tonight from afar. When we kind of started this conversation of getting you on the show, I almost got really excited because I know you had a long, extensive career at Widener, and I thought you may have been still local, but I know you're back in Michigan enjoying some retired life. But at least I'm really grateful that we can at least do this from afar, and technology is a beautiful thing in this regard.
Yeah, for sure.
Yeah, I spent 37 of my 43 years in Philadelphia.
Yeah.
Other than the bad patch interference call Sunday against my Lions.
Okay.
Oh, wow. Yeah.
That is the only time that I will root against any Philly team is when they're playing the Detroit team. Now, my sons, that's a whole different story. Okay?
I bet.
My wife says, "Hey, do you think they'll root for Detroit?" I go, "Oh no, they're all Delco. They grew up in Delco. They are all Delco."
Oh, okay.
Through and through.
But no, the profession of athletic training is near and dear to my heart. I've never worked, at Temple or Michigan or Widener. It was a joy to go to work every day, and I truly mean that.
Yeah.
Because I was dealing with 18 to 22-year-olds.
Right.
For my entire career.
Yep.
One, they keep me young.
Yeah.
And two, I've always had the best interest in any student athlete that I've dealt with at heart. They can anyone can reach out to me, and I've had people reach out to me in the past. One reached out to me just a couple weeks ago. His son, who plays in the Catholic League, had an ankle injury, and because of insurance issues and whatever, the insurance chase is the bane of our existence.
Yeah.
I was able to connect him so he could get seen sooner.
Right.
And to me, that's what it's all about.
Yeah.
Yep.
Is developing those relationships, looking out for the best interests of our the student athletes, the young men and women that we have, so that they are competitive throughout their life, and we can help them out.
Yeah, absolutely. So with that being said, we kind of touched on it a little bit, right?
Perfect lead-in.
Perfect lead-in of kind of essentially what's your background and kind of how did you get into athletic training? How did it all start?
And what was the appeal? Is it just what you talked to us about, or is there, what was it initially drew you down this road?
In the early 70s, 1972, I was a freshman in high school, and I knew that I didn't want to play sports anymore. There was an announcement came over about the JV football team needed an equipment manager, so I said, okay, I'd do that. And then lo and behold, during that first year, I said, I really kind of like the taping that I was exposed to and dealing with the injuries.
Yeah.
And then in my sophomore year, we actually had an athletic trainer come and work at my high school back in Michigan.
Wow.
It's Lumen Christi High School. It's a community school that just has grown athletically, and it gave me the opportunity to look into this profession. And then my junior year, the community college, there was a guy by the name of Wilson Bowers who taught an athletic training course, and he, I took his course. In March of 1975, I got introduced to Lindsey McLean,
Okay.
who was the head athletic trainer at the University of Michigan. And Lindsey was the father of our certification exam.
Oh, okay. Yeah.
Hey, I grew up 20 minutes or half an hour from Ann Arbor. So I was there in the height of the Bow and Woody Wars, the 10-year war. And so Lindsay said, "Hey, we'll have you down for a game in the fall." And actually, that was 50 years ago, 2 weeks ago.
Oh wow.
Wow.
I went to Michigan, and they were playing Purdue, and I saw this operation. As a matter of fact, one of the starting defensive backs, who was from Pennsauken,
Oh, wow.
dislocated his finger, and I saw all this stuff go on. I said, "Man, this is for me."
Right.
No, I may have had a little bit that I'm on the sidelines to 100,000 people at the big house.
Right.
So, I was accepted to Michigan, and I've never looked back since. I knew that I was going to be in college athletics. It just was the draw for me. So I went to grad school at the University of Arizona.
Yeah.
And from there, I ended up at Temple University back in the early '80s,
Yeah.
Okay.
where I had the opportunity to meet. I met Dr. Lockman,
Right.
Oh, wow.
as he's affectionately called his Latch,
Yeah.
and Dr. Joe Torg.
Yeah.
And
one of the godfathers of
those
sports medicine.
Yeah.
yeah, and Joe Torg is the person that invented the Lockman test, and he named it in honor of Dr. Lockman.
Wow.
And then Ted Quadenfeld, who was the head athletic trainer back then, the three of them just said, "Hey, we need to take this collaboration between athletic trainers and physicians and get it to everybody." That's when they started Temple Sports Medicine in the early '70s. It was built literally on the second floor of the parking garage at Broad and Tioga.
Wow.
So I was able to meet all of those. Ray Moyer is a dear friend of mine.
Right.
And the one thing I like is connections that I'm able to develop. So those solid connections brought me back. I went to PT school at Hahnemann at the time.
Right.
Went back to Michigan and worked with ice hockey for 6 years. And then Jeff Ryan, who was a PT/AT in the area, called me and said, "Hey, there's a job at Widener." So I said, "Hey, I'll come out and interview." And the thought was, "Hey, 4 or 5 years, I'll be on to the next best thing." And 34 years later, I retired from Widener last fall.
That's awesome.
Was it Dr. Webner that made you retire? Was that? No.
The joy is working with physicians, at the hip, and that's why I also liked it. Is that my team, orthopedic surgeon, was a guy named Jim Zerbach, and he's still practicing over in Delaware County. You develop a relationship,
Yeah.
so that, and if you happen to work 30 plus years, you really get to understand each other in what's best for the student athlete.
Yeah.
And how, and even if the student athlete chooses to go outside, your system, I was able to develop Temple, Jefferson, Rothman, whoever. I could get them to the right person, and I think that, to me, and Jim Zerbach, said this a lot. It doesn't matter who does the care, as long as we know they're getting quality care.
Right.
That's, to me, has always been the most important thing.
No, and I think that's a great point, and it's kind of one of our talking points of like the collaborative and interdisciplinary approach to care, like you kind of mentioned and touched on. And I think as an athletic trainer myself, in that even with this opportunity of this podcast, my ability to speak with physicians is much improved since doing this in the last, I don't know, we've been doing it, 3 years now, I think?
About that, yeah. We've been at it for a while.
Yeah, it's a funny thing that I have various relationships with different doctors all throughout the South Jersey area now, and it's like making that kind of like planting my roots in a little bit and growing.
Sure.
And I think that's, like you said, it's getting to know these physicians, hand in hand and working with them closely. It's just one of the beauties of the job, really, what it comes down to. And it's like you grow these relationships, and then you're just like, oh, yeah, they're just people, too, at the end of the day, right? Like, that's just something that took me a while to figure out.
No, I remember having conversations with physicians as I grew in my career. I had hockey player at Michigan that I knew had a torn rotator cuff.
Right.
Mm-hmm.
And my orthopedic surgeon at the time said, I don't think so. God, look,
Yeah.
this is what I was just saying, look, I think this is what it is.
Yeah.
Mm-hmm.
He says, well, let's get the imaging. And it was like, hey, yeah, we all can learn from each other. And as I got to be the elder statesman, we had a football player at Widener my last year that was knocked unconscious.
Mm-hmm.
And by the time, as a matter of fact, the other time I had a football player knocked unconscious was at rowing.
Oh, wow.
And both of these had the same presentation. By the time I got to them on the field, after ruling out any cervical spine injury, they were completely asymptomatic. And I had the two fellows with me. Dr. Weber was unavailable that one game. He said, "Hey, just take them underneath, just do an evaluation, and then we'll talk about it." Well, they came out to me and said, "AJ, his evaluation is normal. Why is that?" I go, "Well, it is not an uncommon thing in some concussions, where even though they're knocked unconscious, it's like a reset." I said, he says he wants to play. I go, "Well, we." I said, "Ain't no way that's happening."
Right.
But
Right.
the fact that I have became a mentor to some fellows meant a lot, because that meant they have respected the profession of athletic training. They respect what I've done over time, and I think that one of the big take-home messages is to any young professional is just have conversations with those that you're working with. Because you can learn an enormous amount from each other. And I know, Dr. Frey, you would probably agree that what the athletic trainers can do to enhance your care is incredible.
100%. Yeah. It's and we get a snapshot of what's going on when we see the patient in the office, and when we're there on the sidelines, usually for a game, or if there's a training room, in the training room, but we're not there all day, every day. We're not spending, so the information that can be gleaned or obtained is invaluable, right? Like, it's a huge difference, and it's incredibly helpful. So yeah, like it's pretty important to be working like in concert, hand in hand. And, part of the reason why we do this show is you get a little bit of slightly different perspective, right? From the training background is slightly different, and there's even a little bit of a difference among the docs between like the primary care sports med docs and the orthopedic sports med docs. It's a slightly different filter that you're viewing it through, but it's really helpful to have everybody's intake or everybody's opinion, because that's really what you need in terms of, like, the main goal is getting that athlete back, and getting that athlete back safely, and trying to get him back as close to or more than 100% prior to the injury.
Yeah, and I think, to me, that's the beauty of what I've seen over my 40-plus year career, is that when I first started, the orthopedic surgeons, no, it's my decision, boom, 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 boom.
Right.
You can't have a second opinion.
Right.
That means you don't trust me. To where it's more collaborative. Now, we all know that someone has to make final decisions.
Right.
And the physician is at the top of that for obvious reasons.
Yeah.
Right.
But I think that any physician that is worth his or her weight in gold will listen to the medical professionals at his or her disposal. Because, like you said, the thing that really sets athletic trainers apart is the fact that we're embedded in various settings.
Right.
Obviously, the athletic setting, we see that, but they're embedded in the military. They're embedded in the performing arts, where you get to know those individuals. You get to know what makes them tick.
That's right.
So that you can move them forward, and at the same time, we can grab them by the horse collar and say, "Look, dude, you need to chill a little bit. We'll get you there."
Yeah.
We can give that day-to-day perspective.
So in that vein of being embedded in multiple different places, there is a very kind of standard, I think, athletic training pathway, right? Like you get your training, you get your certification, and then you're working with a sports team. But there really is way more options than that. That's not just the only pathway. And you just alluded to some of it. What are some of the other, if someone's thinking about going down this road and going into this field, someone's in college, they're trying to figure it out, what do they want to do? They have an interest, what are some of the other options that are out there to them?
Well, I'd like to say the sky's the limit.
Right.
All right. As you know, our educational pathways changed. We are now at the professional level of master's entry, which I think is important because of the depth of knowledge that we have up there. I happened to be on the board of directors when that was first okayed by our alliance, which is the Board of Certification, the NATA, the Research Education Foundation, and Katie, which is our educational arm. Obviously, the educational arm said, hey, this is what we should do. And we moved it forward. And because of that, we've got great, we've enhanced our education. And when I graduated, it was just secondary schools, maybe some professional sports, but the collegiate setting.
Yeah.
But as I alluded to earlier, Joe Torg, John Lockman, Ted Cladenfeld put forth the first university clinic-based setting in the country. So it gave an opportunity for athletic trainers to work in a clinical situation if they chose to.
Yeah.
And I think that other areas saw the value of what athletic trainers can do.
Very much.
So now you can work in the performing arts. Okay, we've got there's an athletic trainer. She works up with the Rockettes.
Yeah.
We've got an athletic trainer that has worked with NASA down in the Cape.
Wow.
The big companies have seen the value of how athletic trainers can troubleshoot.
That's right.
For work hardening, like with FedEx and
Amazon.
with Amazon.
Yeah.
One of the better examples I had was right across the river at Boeing.
Oh yeah.
I had the opportunity to tour those 3 plants over there, and there was an athletic trainer in each plant, and the one which builds the Chinook helicopters from soup to nuts. The fuselage is there, and there's a riveting station, and the athletic trainer there, who happened to be one of my former students at Temple, said, "Hey AJ, so this is nice, but here's my concern with how they're working. Okay, we can't do a whole lot to change things, but because of the way they have to hold the riveter, et cetera, that could lead to some wrist injuries or whatever. Well, that's no different than having a conversation with the offensive line coach or the basketball coach or the wrestling coach or the field hockey coach about, hey, we need to make some modifications for the betterment of the athlete. So the athletic trainer has that acumen to do that. And we're embedded in the military. We're embedded in SWAT teams. If there's an opportunity for you, it's there. There is one group that I call. I tell this and I use this a lot. Is that if you want to be a moron, okay, and by that I mean is if you want to get in a plane, put on a parachute, fly over burning forest fire, okay, and jump out of that airplane into a forest fire to be an athletic trainer for smoke jumpers, okay, you can do that. Now I think that's a bit moronic. I want to stay in an airplane, but I think that we have seen so much growth in the profession that what we can do to enhance in the team collaborative care is still untapped, and I think that people have recognized that athletic training is a great profession to go into, and there's just so many more opportunities for individuals.
I don't think at this point that within the general public, it's sort of maybe the black box of a profession that it was maybe 10 or 15 years ago.
Yeah.
I think at this point, it's pretty well established. You know, the amount of education, the amount of training that athletic trainers receive, the very, very qualified and very, very capable healthcare professionals. And whereas, 10 or 15 years ago, I don't know that enough people, the average individual, recognize that. It's out there now. Like you said, the amount of opportunities that are out there for athletic training now is it's almost like endless, right? There's so many different options, so many different directions you can go in, because the rest of the world has sort of caught up and kind of figured it out. My gosh, look what they can do, and look how much they know, and so I guess some of the onus is on you now to keep growing that.
From a national perspective, as the president of our national association, is to make sure that we continue to spread the gospel of athletic training throughout the world, and truly, athletic training and therapy is a global profession. Yeah. As I said before we came on air, I was in Ireland a month ago for the World Federation of Athletic Training and Therapy for their World Congress.
Wow!
And it was a very well attended meeting. We had several student programs from the area. I mean, I was intrigued with Lebanon Valley, Alvernia, Messiah, and there was one other that escaped me, and if they're listening on the radio, they'll yell at me. But anyway, they were all engaged. They posted presentations. There was a section just for students.
Wow.
We are really, it's great to see, what we're doing and how we are affecting medical care, how we are recognized. I know that the 34 years at Widener, I was able to build a program. Dr. Webner and his predecessor, Dr. Slaney, were the centerpiece of this. But the care that we started to generate within the athletic department, especially with concussion care, spread across the campus. Yeah. So that we had touch points there. The other thing that we are part of that's just out of the day-to-day medical stuff is setting up emergency action plans. So that when an emergency, it's not if, but when it happens on campus, you have it can be seamless. It just moves. And the touch points are with campus safety, with student health, with the local EMS. I'd like to share a story with, we had a lacrosse player injured, and one of my grounds crew padlocked the gate so I couldn't get the ambulance on.
Oh, man.
Well, hey, and again, this is where communication is critical.
Right.
I was able to talk to my fire marshal. We had a bolt cutter somewhere, but I couldn't get my hands on them. So he said, Chester Fire has it. I said, bring it. Well, we found it, and then I was able to talk to the grounds person the next day. And I said, well, why did you do that? He goes, look, there's a lot of people driving on the track, and we just need to minimize that. I said, well, you need to share that with me. He goes, well, I put the combination over in the hallway. I go, well, that's not going to do me any good. So the take-home message for me on that was, I put the blame on me from the standpoint that, I didn't even think to bring in the grounds crew into the conversation. So it was a learning experience. I went right to the head of grounds, and they were most appreciative that I reached out, and they said, you know what, that makes sense. Yeah. So, just when you think you've got all the areas covered, when you're doing some of these, it's important that you evaluate again, constant evaluation, so that when it happens, it's seamless. I still sit here thinking about DeMar Hamlin's situation with the Buffalo Bills. A couple of years ago, I was able to meet DeMar this past January at Radio Row for the Super Bowl. Okay, it's a wonderful human being. But I'm just sitting there mesmerized by the whole scene, by how boom, 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 boom. it just kept moving. And we have our hands in very important areas on the campuses where we work.
Similar vein, similar experience, where there's I have a tendency where when I'm at a sporting event, and sometimes not even like a sporting event, just any like crowded event, I have an eye out for where is the defibrillator, like where's the AED, right? And at a local school, I'm at an event, and I know that they keep the AED in the men's bathroom, under the bleachers, under the stands, and I go to use it, and it's locked during the sporting event, and because it's a night game, blah blah blah, and this and that, and like I realize like the potential major issue right here, right? Like there's who knows where the next closest one is going to be. So similar vein, like it's nice to have the antenna up. It's nice to have more than one person working on it, and I really like the way that you kind of cage that you phrased it, where like, I kind of took on the blame, said like I should have considered this. I should have had the sort of the groundskeepers keyed in a similar vein, where then I spoke with the AD, like, hey, this could potentially become an issue.
Right.
Unlikely that it ever will. But if it does, it's a bad problem.
You don't want the AD locked,
you don't,
right?
Yeah, exactly. So like solve that problem while you can. Think of all these other factors kind of that lead up to how do you make that moment that that only happens a couple times in a lifetime. How do you eliminate the issues in the moment, because you don't really get many second chances at that.
We learn from our experiences to move forward.
Right.
Yeah.
A couple good examples is we were over at Messiah in Grantham, PA, with I was with lacrosse, and our softball team happened to play there. Before the game, we're sitting there, and one of our parents is hit in the face with a softball.
Oh.
Okay. So I'm over there, and I'm able to give initial care, and I could see the anxiety in the parents, because we seem to be waiting an inordinate amount of time for an ambulance. And I was able to say, oh, hold on, folks. I said, we're in Grantham, PA. I said, the closest ambulance, I'm guessing, is maybe 15 miles away, right? As compared to, if you're over Chester, at the time, it was, Crozier, and their ambulances was 1.5 miles away.
Right.
So just having those conversations and understanding that works well. We had a track athlete a few years ago. As she came out of the last turn, she fell, tripped, and when I got to her, she was. I knew there was an issue, so I called, activated the EMS right away. She was complaining of neck pain, so I said, "Okay, just wait here." We had stabilization. All right, ambulance came onto the field. We got her packaged, and off she went. And my student at the time said, "Oh my gosh, AJ, that took forever." Well, I said, "I've got a timestamp here, because I activated EMS, and then as we're putting her into the ambulance, my wife called. So obviously I didn't talk to my wife, but I had a timestamp.
Yeah.
It was 20 minutes.
Yeah.
And when I told her that, I said, if I told you that in 20 minutes we activated EMS, we got her packaged in the back of a ambulance, what would you say to that? She goes, "Well, that's pretty good." I go, "Right." So the take-home message is, in those emergency situations, minutes turn into hours. It takes forever.
Right.
It just seems like you're, forever. So, and again, I think it's my job, and anyone's job, as you learn things, is to share those with colleagues, so that you can make those situations always better the next time.
Yeah, and I think, like you said, like going back and being able to review those things, and it's like, as I've grown in my career, I kind of sometimes jokingly say, like, we're professional problem solvers, of like, we try to look at the big picture and try to figure all those things. And just recently we had a cervical spine injury on a football field, and we had to spine board somebody. And, looking back, we reviewed it, and I got to watch the clip on our YouTube, and I was like, Well, it seemed like it took a while, and there were some things that we could definitely work on in the future. But at the end of the day, it took about 10 minutes that the kid went down to when he was on the stretcher going into the ambulance and then on to further care. So at the end of the day, like you said, it felt like an hour, but really in
Right.
reality it's about 10 minutes. And then even so, you go back and look, and just recently at Rowan, we just got approval and we have AEDs now at all of our different athletic venues, and that was like something I suggested for big ticket items of like what we could do moving forward. And I was like, why not have an AED at every venue that we have?
Yep.
But then that posed a new kind of problem of when you open the AED box in front of a crowd of people, you have an alarm going off the whole time. So it's like, okay, maybe we don't use that for game situations, and that's a practice only type deal, or like in the stands or something along those lines. But we have an AED in a bag, and if we're running with a bag, no one really knows the difference between that bag and any other bag. So it doesn't literally raise the alarm and cause a little bit more chaos and havoc to tense situations where everyone's trying to at least for our standpoint try to stay cool, calm, and collected, and not like freak anybody out.
No, and again, the thing that I always preach is to be focused, and people are going to look at you.
Yeah.
And Dr. Fry, I'm sure the same thing is that you with the OR is that if something goes awry, you're the one that's going to be the calming influence on the situation.
Very much.
It doesn't mean that you're not going to get a little bit more focused. You're going to be a little bit more. Your verbiage is going to be more commanding in a very professional way. So I think it's everyone looks to someone to be the leader, and a lot of times in those emergency situations, especially at the Division III and secondary school level, it's going to be the athletic trainer.
Yeah.
You talked about, Brandon, about learning, and Dr. Fry a few years ago, Art Bartolozzi gave a great lecture on how the ACL care has evolved.
Yeah.
And I went up to him afterwards. I said, "Damn, Art, that was a great thing, but I'm really upset because I was around for all of those changes in ACL care."
Yeah.
But I think that we're always trying to find that sweet spot to get a person back to their activity of choice.
Yeah.
When they can, as long as they meet the metrics of it's going to be safe, you're not going to do any further injury.
Right.
We've seen ACL care go from, we can have you back at 6 months to where, probably should wait 10 months to make sure that those fibers are healed accordingly.
Yeah.
My first arthroscopic procedure I saw was back in the late 70s.
Oh.
And I was looking through a microscope.
Right. Yeah.
And to now where, you've got the greatest setup so that you have clear vision of field.
Yeah.
The advances that we have made are just quite remarkable.
It's mind blowing. Yeah. The differences are incredible. Short periods of time, major changes have transpired.
We all have the vision of having a great outcome.
Right.
And at the same time, a great outcome is going to have very different implications depending on what kind of injury you have.
Yeah.
And the significance of that injury, and will that individual be able to truly return back to his or her sport? And hey, we're faced many times with, it might not be in your best interest to go back to sports, okay, because of X, Y, and Z.
Right.
And the physician is there to work with them and give them the explanation. And a lot of times it's the athletic trainer who's going to be there.
That's right.
To help bring that person back to a clear understanding. One of the thing that I've noticed the last several years of my practice is the mental health aspect of things. And to me, we've made inroads on mental health I would tell parents when they would come in for their recruitment, I said, hey, here you're going to get good care here. If we have to, we can send you up to student health to get care there. And I said, if an ankle sprain and a brain sprain are the same thing. And I said, we've got a great mental health practice on campus. And I would always say, well, I'm not sure why, but the mental health practice is right next to where you pay the bills. So, anyway, but I think the more that we can talk about mental health, and that all it is it's a challenging injury, just like we see other challenging injuries orthopedically.
Yeah.
And if we get to the right person and have the right conversation, then we can work so that you can work with that mental health issue that you have. I'm all for just being an open book and, hey, look, let's have the conversation. Well,
Right.
I'm not sure. Okay, well, hey, we'll keep prepping you and giving you bits and pieces of things so that you become more relaxed in having those conversations, both as an athletic trainer and as the student athlete. You know what, AJ, maybe you're right. What would it? It won't hurt for me to just go have a conversation. Oh, hey, look, ask it. Just start the conversation.
So it's funny that you kind of went down this road. Brandon and I had a conversation, sort of a similar vein, not quite exactly the mental health vein. The okay, it's okay to not be okay kind of discussion, but in a similar vein to get your take on it. And it wasn't one of the things we had necessarily had on our list as things to talk about, but you've had a lot of years working as an athletic trainer and working with students. Do you have any advice or strategies for keeping an athlete kind of in the right direction? One, not getting too down on themselves, especially during an injury. Two, kind of keeping the recovery-minded focus for the physical injury, not for the mental injury, but for the physical injury. Is one strategy fits all, or do you individualize it for that particular individual as you've gotten to know them along the way? What's the best way? Because that is a big factor in the recovery process. And any advice on how best to manage that part of the equation?
Well, someone told me a long time ago that nobody cares how much you know until they know how much you care.
Right.
Yeah.
And that is how I've always approached my treatment of student athletes over the years, is just having conversation with them. They can tell that and that conversation can bleed over to the parents as well too. And those that are at the professional level to the significant other, where they know that there's a genuine care. And that's not to say that physicians don't genuinely care. I know they do, because I see them in action. But we have the opportunity, like we said at the onset, I get to know these individuals over time.
Yeah.
And we know what makes them work and what doesn't make it work. And we can have those frank conversations and say, hey, let's step back a little bit. Let's take a little bit broader picture here of where we are. We all face those student athletes. I just want to get better. Well, let's look back. Let's reflect back at where you were 6 weeks, 3 months ago, whatever.
Right.
Okay. And see how far you've come.
Right.
Okay. That last 20 yards, so to speak, is sometimes the toughest to accomplish.
Yeah.
And if you focus on that too much, then you're just going to become more and more frustrated. So I think it's it's keeping it real. Having the conversations with them. Hey, look, this is where you are, and here's why. If you want, I could get into all the medical jargon as to the whole healing process and why we need this time. Okay, but we're going to get you there. And I also think at the outset, the conversation is, for instance, I had a lacrosse player that tore his ACL at the end of the season a couple years ago. And he ended up having surgery, I want to say May-ish or whatever. And I told him, I said, look, I'm not going to be here when you finalize your return to play.
Right.
My recommendation is that you're not going to be, I really believe in the 10-month rule. And I said, your option is there's a medical hardship. He goes, look, AJ, here's the deal. If I'm ready to go, I'm going to go because I'm not that smart of a cookie. And I just want to get my college career over. I said, well, that's fine. But I think they appreciate having that overall conversation.
Right.
Brian, as you know, at Division III, very rarely is there a next level.
Right. Yeah.
And they want to make sure that they have that they get there, so that they can play that final game if they can.
Right.
Yeah.
So it goes back to, hey, we get to know them. They know that we care deeply about them, and we can pick up on those nuances. And when they can see that, they may open up and say, "Hey, Dave, I'm having some issues here. What can I do? Who can I speak to?" And when they're in that situation, I'm ecstatic because I know we can help them totally, so that they can get back there. The flip side is the student athlete says, "I don't want to do this anymore."
Yeah.
Okay. I've had it. I mean, hey, I want to be able to hike. I want to be able to pick up whatever. That's fine. And we can help them work through those dynamics with their coaches and family, because sometimes the coaches and family may have a little bit different idea of what the next step is. So on both sides of that, we're right there in the middle to have those conversations and to be there for to assist those student athletes in that athletic setting that I've been in, so that it's successful.
Yeah, and I think with that said, is like we're the big picture viewers most of the time of like, yeah, I know it's just, I don't know, put any body part. It's just a finger, it's just a wrist, it's just whatever, it's just this. But, 10 years down the line, if we don't take care of this now appropriately, you're going to have issues where, like, later in life, it's not that great. And you're going to be like, oh, I wish I did this, And sometimes you got to sit them down and like, hey, wait a minute, let's talk, like I said, big picture, and let's really look at what we're dealing with. And let's not rush to conclusions and try to like push through this. Yes, at times you can be aggressive, and in our profession, we're the beauty of sports medicine. You kind of walk that line sometimes of being aggressive versus like super conservative. But being that voice of reason sometimes helps. And like you said, with that, these daily development of like this relationship you have with your student athletes over time, right? You meet them when they're sometimes 17, 18, and then you send them off for the last time when they're 21, 22. Yeah. It's like, oh, you kind of help them grow up to like the next stage of adulthood. And you're like, oh, yeah, that's right. They're making sense of what they're saying now. It's like, this isn't just for a game. It's like later in life, I'm going to need my shoulder to pick up my kid or whatever the case is. And they certainly sometimes don't see it that way. But being the voice of reason sometimes is, you got to play the good cop, bad cop kind of deal.
And I got to tell you, that, the voice of right now of reason or of experience, it's a really, really good point that you bring up, AJ, where sometimes, I think we tend to think about it as how do we get them back? How do we help them stay in the right frame of mind so they can get back? But every now and again, maybe the help is, if their goal has changed, to help them relieve of the expectation of others, like then help guide them through that. Like that's actually a point I had never even considered, and it's a really good point that you just made.
When I taught therapeutic exercise at Temple for 25 years. And in my rehab course, I would say, I don't talk about return to play. I talk about return to function.
Yeah.
Okay? Now, 95% of the time, that return to function is actually return to play.
Right.
But I think if you come with that mindset, hey, this is what our plan is, that you functionally better do this, and this, it gives them a realistic perspective.
Right.
And as you said, sometimes we have to play bad cop or whatever it is, because we get the best interest in them. Yeah. And that will carry on. And Brandon, someday, if you stay at a place for an extended period of time, this is going to happen. I got a phone call a few years ago from a baseball player who had finished in 1999. So this is probably about 5 years ago. And he said, hey, my 12-year-old son is having an issue with a wrist. Would you mind having a look at it? Okay. I said, sure. I
Right.
said, I got one question for you. He goes, what? I said, is your 12-year-old son taller than you are? And the kid goes, we're going right there. I said, yeah, I'm going right there. I said, you would be disappointed if I didn't go there. So the relationship that you develop keeps them wanting to come back
Right.
Yeah.
and seek your counsel. And this is, I had a feeling this young man had a scaphoid fracture. He did. And then I was able to mentor the father again as he as his son was going through the final stages of rehab.
Right.
He goes,
Yeah.
AJ, what I said, stop. I said, he is your spitting image. Okay? He will go through the wall for you. But I said, let's take a step back. He's 12 years old.
Yep.
Let's just kind of, move forward with that. And again, the reason they come back to me is because they've had conversations with me over the years. And word gets out, good, bad, or indifferent.
Right. Right.
That AJ's always has the best interest. He's going to move me to wherever I need to go, at wherever walk in life I am.
Yeah, and that's one of the things that comes along with your time and experience, and you're laying that foundation of just that generalized care that you, like you said, big picture, and you always have the best interest for your student athletes. And I think that's something that develops over time, like you mentioned, and sometimes we're viewed as the people who take student athletes out of their competition, the sport they love, but at the end of the day, it's always the same idea and the same reasoning is for their best interest. And it's just like, yeah, sometimes we make those hard calls of pulling a senior out in their last game because they just, unfortunately, just it's not a good idea for them to go out there or whatever the case is, and it's just the nature of the beast in a sense.
What do you think happens as AI continues to develop now?
Yeah.
How do you think? It's impossible for any of us. It's an impossible thing for any of us to predict at this particular
Right.
point. But what are your thoughts on that? What's going to be the AI impact on athletic training?
Well, I think that like anything that's relatively new, and AI, to say it's relatively new might be a bit of a push, but it's to clearly understand you want to control AI, meaning you want to make sure it's working for you.
Right.
Right.
I've seen I've said it in a couple seminars, and I think what AI can do in many ways is really help streamline one's practice.
Yeah.
Hey, I can dictate notes. I can let AI kind of clean things up a little bit.
Yeah.
I review them. Boom. I don't have to sit there and write.
Mm-hmm.
I know in some of the things that I have to write, for letters or for articles, whatever, I'll have AI input just to kind of make sure that it's clear, concise.
Right.
So I think that we need to make sure that we embrace AI because it's not going anywhere.
Right.
And we've got to make sure that we clearly understand what AI is all about and what it's not. And I think that it behooves us to make sure that we prepare appropriately for that, and that we learn about it so that we can utilize it rather than it just taking over, a practice that you're in.
Yeah, and I think we see that a little bit now in the world of college athletics is that Dr. Google has a lot of say in diagnoses and plans of care and treatment algorithms and whatnot. And you kind of always are. I feel like more recently in recent years, it's always like, oh, I gotta compete with Dr. Google and what that said and what that diagnosis is and how long that's going to take or whatever the case is. And it's not everybody fits the mold of what Google has in store or AI or whatever. But like you said, I think you have to control it.
It's a resource.
It's a resource, and I think it's helpful for,
Absolutely.
even as, I'm, what am I, 11 years in at this point? Like sometimes I utilize just to kind of review some things. It's like, I haven't listened or heard about that in a while. Let me just kind of check in, and it helps. It kind of can peruse some research and kind of give you some outcomes with some sources. I mean, you can make your own determination if the source validation, if it's a good source, to like a resource or article, a research article that you can reference. But like you said, controlling it's the biggest part, and not letting it like be the end all be all. But it's a tool in the toolbox, and why not use it and help out if you don't know something? Like, why not look it up, or whatever the case is, and just streamline that process to not spend hours looking through library articles or whatever the case is, searching the big databases when you can kind of get it quickly at your fingertips. It's super helpful.
No, and I think that another aspect of this, and I know Dr. Fry can attest to this, it's called medical arts for a reason.
Right.
Yep.
I remember Jim Zerbach telling me that he did a lot of emergency care. He's on the table prepping someone that's got this very complicated compound femur fracture, whatever, and he goes, this isn't going to end well because of how much Humpty Dumpty was destroyed. And you just have to try and do the best you can with the knowledge you have to make it work.
Yeah.
And that's, the whole, people can look at AI and WebMD and all that in one vein. And I say, look, at least you've got people that are interested in their healthcare.
Right? Yeah.
And it's our role as a medical professional to cultivate that, say, okay, yes, yep, that makes say, but here's what we see here, and here's why we're going with this direction.
Right.
Again, it's an intentional conversation. And yes, I know that some of those conversations can be absolutely, I'm going to use an old phrase here. Hopefully some people remember this. Putting your fingernails on a chalkboard, right?
Right.
A what board?
Yeah, I know. But again, it gets back to what our basic tenet is as a healthcare professional, is that we want to work together for the betterment of the athlete. Yeah, Dr. Fry, you like this. Dr. Andrews came through and talked over at the Philly Orthopedic meeting, 20 years ago.
Right.
And he was talking about a parent that had a 12-year-old son who had this really significant elbow pain.
Yeah.
And what he told, the dad was all happy. Hey, we're using a weighted bat and we're swinging like 300 times a day. Okay. And so Dr. Andrews could have said, you know what? Hey, look, that's stupid.
Yeah.
Okay. That's not, he shouldn't be doing that.
Right.
But he goes, if you do that, what's going to happen to that patient?
Yeah.
He's going to take him somewhere else to
Right.
get the information that he wants to hear.
Right.
As
Yeah.
compared to, okay, all right, hey, well, let's try and modify things so that your son's pain goes away. And then you can emphasize, hey, he's still a maturing person.
Right.
And the stresses that are placed, So again, we just need to make sure that at the end of the day, we've always got the best interest of our clients, of our student athletes, of our patients. And I think that as a physician, as an athletic trainer, as a physical therapist, as a nurse, all of those touch points have that.
Right.
Then what will happen is we can give the best care to those individuals. And if they choose to go elsewhere, that's okay. We've done our best. And sometimes it's a very hard, pill to swallow.
Right.
But I think, and to any young medical professional out there, anyone that's interested in going in medicine, is if you give it your best, okay, that's all that anyone can ask.
Right.
Yeah.
Don't try to be anything that you're not.
Right.
I've never said that I'm a physician. Okay. I've always pushed my knowledge to the limit so that I could just to advance my own knowledge.
Yeah.
Sure.
But I know right where that line is. And hey, the handoff, hey, the only thing I care about is a very positive outcome.
Right. I was going to ask, what advice do you have for, a young athletic trainer entering the field? And I think you just covered some of that.
Yeah, you definitely almost hit that one right on the head right there.
Well, The thing that I tell people is you can't BS people. They'll see right through it.
Yeah.
Yeah.
Okay. If you're not sure of what the issue is, then say that. Okay.
Yeah.
Now, obviously, you can't say that all the time,
Yeah.
Right.
but I think
Right. Right.
you're going to gain more respect. You go, hey, let me check on this, and I'll get back to you on that,
Yeah.
Yeah.
and then get back to the person in a timely fashion.
Right.
Know what your limitations are.
Yep.
Okay. Know what your role is in the healthcare that's being delivered in a very collaborative function.
Right.
Okay. And as you grow in that, all right, as you mature in that, people that you work with on a regular basis are going to notice that, and you're going to get more and more leeway. Um, because the physicians will know that, hey, yep, it got to the point where Jim Zerbach would say, AJ, just do that voodoo, what you do. All right? And that's what you want to have, is the trust that is developed between physicians and athletic trainers, okay? Between athletic trainers, and I know, Brandon, you see this with the Rowan staff, is you've got to mentor some of the younger professionals
Yeah.
and help them, navigate, how things need to be done.
Yeah.
And we need to be there to give them the proper nudge, the proper encouragement, to move forward. And I think that when you have that great collaboration across the spectrum, that the end product is the people you give medical care to are really going to, survive and strive
Yeah.
moving forward.
That's I think that's a great point.
Yeah.
Almost a great ending point on that note as well. One kind of final question for you, AJ here. Well, two-part. There's going to be a second question after this, but you're recently retired and now you are the NATA president. So what is life like for you now outside of college athletics and in the presidential role, if you will?
Well, people ask me, do I miss it? I think that because I knew what my end game was going to be, and I knew that I couldn't do the stuff that I did on a regular basis anymore. My body just was getting to the point where I just can't lug all this stuff all the way.
Right.
So I intentionally thought, hey, if I could get this NATA president gig, I'm going to retire, and then I can do this.
Yeah.
I've seen some enormous challenges faced by our association that we've been able to weather. I'm glad that I've been able to give that give myself fully to that. At the end of the day, my wife and I get to go see a 5-year-old and a 2-year-old, granddaughter and grandson.
Yeah,
That's great.
So I've prepared myself mentally, for that next step in my career. Now, I know you're going to come up and say, what's going to happen in 2 years when they kick you out the door in New Orleans? Not sure yet. But the one thing that I do take very seriously is that I talk to young professionals and I talk to students on a regular basis. I say, I can't change the fact that I'm a baby boomer. I can't change the fact that I've got gray hair. Okay?
Yeah.
That's just who I am. But I said, what I need from you is I need to help you mold the vision, just like my mentors did, for me as I came up in my various leadership roles, so that you can move to the profession to where you want it.
Right.
And I think that when it's all said and done, I'm not looking for to continue any committee positions or volunteer, other than be a resource.
Yeah.
For people, and so that they can take it to the next level. Athletic training is a profession that I love. It is near and dear to my heart. I've done it since high school.
Yeah.
And I'm able to continue with it by going to various places and meeting just some unbelievable students and unbelievable young professionals and unbelievable folks like us that have been around for a while. That our job is to make sure that the baton is passed with them, and they can see the enthusiasm that we have by getting back to this great profession of athletic training. And I use a quote from Fielding H. Yost many times, who just talked about, he talked about Michigan, and I just implement athletic training, that this great profession of ours will give back to you so much and so much more if you give it the opportunity. And I will do anything that I can for the profession, and it just means that much, because I've seen the growth, I've seen what it can do, and I know that we are a healthcare profession that the sky is the limit for the future.
Sure.
Yeah, it's right there. That's as well said, and that you heard it here first, folks, from the NATA president. And then before we go ahead and close out here, we do like to ask. We didn't really ask in the beginning. Dr. Frey and I,
kind of at the end here.
We kind of we're going to close with it for the most part. Dr. Frey and I enjoyed a nice beverages this evening from our good friends at Neck of the Woods.
It is Cold Sports Medicine on tap.
It is on tap for a reason, right? So, do you have a favorite drink of choice or beer of choice that you maybe be embellishing in a little bit more now that you are in the retired sector of your life here?
Well, my palate is changed. I was never much of a hops and barley kind of guy. I was much into the grapes with things, and since then I've kind of changed to a different type of thing with the whiskeys and the bourbons.
Oh, okay.
I was in Ireland, and I thought, I like the Irish whiskey, Redbreast, which we can find here in the States, obviously.
Yeah.
But I found a thing called, there's spot whiskeys in Ireland. There's single pot whiskeys, and I settled on Yellow Spot. I brought a couple back from Ireland, and they're great. Of course, Blanton's, which is I've kind of got an accomplished taste for that.
Sure.
But the one thing that I noticed is that the aged bourbons also escalate in price pretty significantly. So that's another thing as well too. But I think that I enjoy having some whiskey or bourbon, and just I've got a little contraption that makes clear ice balls that
there you go.
That just last, and matter of fact, they have AJ on it. I thought that was a pretty good thing I could do, is have that.
Nice.
But I think I kind of enjoy those.
Yeah.
And to kind of wind down on some nights.
There you go.
I feel like when you're going in that direction and you're factoring price point, I feel like ryes tend to be a little bit underrated, right? Like they're pretty tasty, and you get a little more for your money, right? Like scotches, like at the top, bourbons like in the middle, but pretty expensive, and ryes still wonderful, but maybe not quite as high for that good one. Yeah, I don't know. That's my own experience.
So, AJ, if you don't mind, just hold on the line real quick, and we're going to go ahead and close out our tab here for the evening.
Yep.
We're going to give a quick shout out to our sponsors, Virtual Orthopedics and Spine, from runner's knee to dog walker's hip. They got a doc for that. Yardwear back and laptop wrist, they have a doc for that too. Virtual Orthopedics and Spine has over 120 providers, over 20 PT and rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtual.org/ortho. Neck of the Woods Brewing Company, giving us the best beer in South Jersey like always, and Timber Reel Productions, helping us put all this multimedia together for all our fans out there. So we thank everybody, and we'll see you guys next time. And a big shout out and thank you to AJ Duffy, the president of the NATA, taking his time out of his night tonight and chatting with us. And I do hope, AJ, you and I can connect sometime at a conference very soon, and we can have a discussion over actual glasses of beverages if that happens. So
a little bit of whiskey.
A little bit of whiskey in that regard. So folks, we'll catch everyone next time, and thank you for listening.